Hello friends. So I hope your prof examination preparation is going fine. And today we'll discuss up the most important topic which ought to come in your exam. Definitely you will have the question regarding this because this is important as per the clinicals also. In the future, you will deal up with these types of patients when you are there in the medicine and pedia. And along with that, this particular one forms an important basis even in the path, in the micro, and even in the biochemistry, the meningitis. Okay. Obviously, meningitis is being done by a lot of other microorganisms also, but the main one, which is holding up the main onus, is the bacteria. So, we'll discuss of the bacterial meningitis more detail, and the rest of our others will talk about in the form of the names and all, because this is what is you ought to have in the exam most likely. Okay. So, guys, it will be good that if you participate up in the discussion and all. And I'm seeing up on my live chat also. If somebody is there, they can ask up some questions also, obviously. And as such, this particular question definitely you will find as a short note or a MCQ or a long question for sure. Okay. So, guys, without wasting much of a time, let's start up with this particular topic. And first of all, let me show you a case scenario that how the examiner will give you this particular question. Or a MCQ or a long. Fine. So as you can see up in this particular one question that a 14-year-old girl is there which was sent home from the school because she had a fever of this much 102 degree Fahrenheit actually and a severe headache and was falling asleep in the class. Her fever rose up to this particular one and her mother took her to the emergency room when the blood pressure have fallen to how much 60 by 20. That means this particular one is about what the patient have landed into what septic shock because it have drastically decreased to 60 by 20. Severe petechial hemorrhages were found and the gram negative diplococci. Gram negative diplococci. See the hint in the question itself. They are giving the hint that what they want to ask. Gram negative diplococci were seen in the gram stain of the spinal fluid. Spinal fluid means CSF. Which one of the following is the most likely to cause the fever, hypotension, and petechial hemorrhages because of this particular gram negative diplococci? Okay. So, guys, the fever is very high of this particular 102 degree Fahrenheit. It rose to this much and the mother have took to the emergency. The blood pressure have also fallen up, means the patient have landed into what shock, that is septic shock, and severe petechial hemorrhages were also found. And which sort of petechial hemorrhages they can give up in the exam? This one, like that. Okay, this can be seen. Okay. Hi everybody. Hi Tinu. Hi Pallavi. Hi Hemant. Fine. So this type of picture you might seen up in this particular question. They might give this. See this tricky question. They have asked up regarding the meningitis stuff and they have told the name also. Gram negative diplococci that was seen in the gram stain of the spinal fluid. And these petechial hemorrhages were also being observed up along with the fever and hypotension. Okay. The patient is going into what? Hypotensive shock. Okay. So guys, tell me, it is a gram negative bacteria and it is a diplococci. And gram negative bacteria, what they have in their cell wall, guys? Lipopolysaccharide or lipo-oligosaccharide. Yes or no? What they have in their this cell wall? Either lipopolysaccharide, and if it is a cocci, as it is given in the question, so that will be what? Lipo-oligosaccharide. Yes or no? That will be lipo-oligosaccharide, and this lipo-oligosaccharide secretes of what, guys? This particular one secretes of endotoxin. What does it secrete? This particular one secretes of what? Endotoxin. ये लाइपो ऑलिगोसेक्राइड ही है जो कि क्या सिक्रीट करता है एंडोटॉक्सिन. Okay, so some of the things I will tell somewhat in Hindi also, and that's mostly it will be in the English, and just I repeat some of the things in the Hindi. Okay, so lipo-oligosaccharide, this particular one is responsible to secrete what? Endotoxin, and this endotoxin lands in the individual with what? endotoxic shock. Okay. So what should be the answer of this particular question, guys? Answer of this particular question is endotoxin. And whose endotoxin we are talking about, guys, here? We are talking about the endotoxin of which one? Tell me. It is of the meningococci. Fine. This is of the meningococci. These particular are the virulence factors of it. These are all are what? These are the virulence factors of this particular meningococci. And out of them, which virulence factor was responsible for these particular conditions which are given up in the question? So see, they have tested your clinical knowledge also, your microbiology knowledge also with one question. So this is the way the things will be coming up in future, either in the next exam or in the NEET exam, whatever it is. So that particular thing also will be tested in that sort and in your university exam also. Okay. In your university exam also, the same thing they will do, and they will try to confuse you by changing up only this thing. Somewhere they will write gram negative diplococci, somewhere they will write gram positive cocci, or somewhere they write gram positive like bacilli, gram negative bacilli. So they keep on changing that particular thing, and along with some small changes, they will try to do in this particular like scenario, and they will try to confuse you. So guys, this is sure that we are talking about what in this particular question. We are talking about the meningococcal meningitis, and how we know that this is meningococcal meningitis. Two, three things are there in favor of that. What are those? One is it is a gram negative diplococci they have talked about. Okay. Along with that, they have talked about hypotension. They talked about petechial hemorrhages, and they all are features of what? They all are features of meningococcal meningitis. Okay, meningococcal meningitis is actually special in this particular regard that it is with the rashes. It is with the petechial hemorrhages. Is it fine, guys? So this type of understanding should be there of yours in tackling up these types of MCQs. Okay, definitely you will get this somewhere. Now, after this, let's come to our topic first. That is the meningitis. So guys, as you know that we have meninges, which covers up the system of ours in the brain. And these particular meninges, you know, three are there mostly. What are those? Pi mater, arachnoid, and dura mater. The outermost is dura mater. So as you can see, this dura mater, that is dur, outermost. Fine. Arachnoid. Dur means like way away. So outer one is dura mater, then arachnoid, and this is pi mater. Is it fine? So this particular picture beautifully tells that what are the various meninges, and the inflammation of these meninges only is termed as what, guys? Meningitis. Okay, inflammation of these meninges only is termed as what, guys? Meningitis. Now, sometimes what happens along with the meningitis, this brain parenchyma is also involved up. And when the brain parenchyma is involved up, so that particular thing is termed as what? Encephalitis. Okay. So meningitis, encephalitis, as such, they are separate terms. If the inflammation is of meninges, meningitis. If the inflammation of brain, encephalitis. And if both happens in one time, that is termed as meningoencephalitis. Okay, that is termed as what, guys? That is termed as meningoencephalitis. Is it fine? So that you need to know first of all. Then, first of all, you need to know how to define of the things and which all cells are increased. Then we compare them in a table, and we will see all the probable scenarios in which the question might be asked in your exam, in your prof exam. Okay. So guys, first of all, acute bacterial meningitis. This acute bacterial meningitis, which we are talking about, is also termed as what? Pyogenic meningitis. Okay, pyo you means no pus. So why it is termed as pyogenic meningitis? Because the neutrophils are there. It's a purulent infection. Okay, it's a purulent infection, and as a written also, it's an acute purulent infection within which particular space? Subarachnoid space. Subarachnoid space, and as you can see in the picture itself, this is what is the subarachnoid space. Fine. This is what is the subarachnoid space, and this is termed as acute bacterial meningitis, also termed as pyogenic meningitis. And what is the characteristic point of this? Elevated neutrophils. Okay, what is elevated in these particular ones, guys? Elevated neutrophils are there in the CSF of these particular individuals which are suffering from the bacterial infection of meningitis. Okay. So first of all, this thing. Then the various causative agents whose name at least should be remembered by you, that at least these 3 4 names should come in my mind whenever we are talking about the bacterial meningitis, and that too which one? Acute, because another one is chronic, and the chronic bacterial meningitis, one example is there mostly, that is the mycobacterium TB. Otherwise mostly they associate with what? Acute bacterial meningitis. Acute bacterial meningitis. Now, first of all, remember the various agents which are implicated in pyogenic meningitis, and that too according to the age. Okay, so what are the various causal agents of this pyogenic meningitis? Remember one thing, if it is asked in a viva also of the prof, or if it is asked up in the like exam, the prof exam, theory exam, or practical exam, whatever it is being asked, remember one thing, that overall pneumococcus, okay, overall, pneumococcus is the most common cause of pyogenic meningitis in most of the age groups. Remember this particular important point and don't confuse. Okay, in all the age groups, the pneumococcus is the most common cause. First thing. Others which are there, this you can remember by a mnemonic SLIM. And what is there in the SLIM, guys? In the SLIM, the S is Streptococcus agalactia. Okay, what is S? Streptococcus agalactia. What is L? L is Listeria, and the full name is what? Listeria monocytogenes. Okay, I is influenzae. Okay, which influenzae? Haemophilus influenzae. Which particular influenzae? Haemophilus influenzae. And M is meningococci or meningococcus. Fine. So these at least 3 4 names now, they should be remembered every time. Okay. And wherever you will put them now, your work will be done. Either in the practicals or in the theory, wherever these particular somebody asks you that which is the most common cause of pyogenic meningitis, and you are confused that all the age groups, what is there in the childhood, this, in the neonates, this. So you have to remember this only, that overall, in most of the age groups, the most common agent which does meningitis is what? Pneumococcus, except the neonates. In the neonates, it is Streptococcus agalactia. Okay. So this particular statement is very easy to remember. That overall it is pneumococcus, but in the neonates, okay, in the neonates, it is the Streptococcus agalactia, which is also termed as group B Streptococcus. That is the most common cause of what? Neonatal meningitis. Otherwise, in all age groups, don't confuse yourself that which is in childhood, what is in the extremes of age and all. Don't confuse that. Okay. This particular point should be very much clear to you that the most common cause is pneumo. And in the neonatal meningitis, there's a Streptococcus agalactia. Otherwise, whether it is child, whether it is adults, whether it is old age, mostly the most common cause is pneumococcus. This should be remembered to the core. Fine. Now, as such, in the neonates, which all others can also do, just now I told up in the neonates, which is the most common cause? The most common cause is GBS. And what is GBS? GBS is group B strepto. What is the other name of it? Streptococcus agalactia. Yes or no? What is the other name? Streptococcus agalactia. Then comes the E. coli. Then comes the E. coli, and some books they write even the friend of E. coli, Klebsiella. Okay, and even Listeria can also be there in this particular list of the neonatal meningitis. Okay, but the most common mostly they ask, and that is Streptococcus agalactia. Just now I told you. In the elderly age group, if somebody asks you that more than 60 years and all, you should remember, I've told you, pneumococcus will always be there because that is irrespective of any age except the neonates, pneumococcus. Along with that, you can remember of the Listeria name. Okay. So Listeria, you can very well see it is affecting the neonates also. It is affecting the elderlies also. So we say that extremes of ages, They're affected by which particular bacteria, guys? The answer is Listeria. Okay, extremes of ages is affected by which particular bacteria? The answer is Listeria. So what is the crux of the things which we get from this? Important is the most overall is what? Pneumococcus. And in the neonates, there is an exception, that is Streptococcus agalexia. Otherwise, don't get into this trap that Haemophilus influenzae in childhood, Haemophilus influenzae in adults. No. Overall, it is pneumo, and in the neonate, it is Streptococcus agalexia. Simple. Is it fine in that sort? Now, how does the transmission happens? How does the transmission happens of the organisms which we have just talked about and in causing up the meningitis? How does the infection goes? So guys, how does the infection can happen? That somebody's having what? Somebody's having some ear infection. Okay. Somebody's having mastocytitis. Somebody's having some ear chronic otitis media and all. So the ear infections, they lands up into what? They lands up into the blood and all. And from the blood, it have gone to the meninges towards that. Okay. So any sort of a ear infection, which is like likely to go towards the brain and does that problem of meningitis. Other than that, like somebody is having iatrogenic stuff. Iatrogenic stuff means like they are being hospitalized for some other reasons, and the doctor does some interventions and all, and through that, the transmission of organism happens up. So that can also be one of the things which lands up into the bloodstream, and from the bloodstream it goes towards the meninges. So that can also happen. Okay. Another important thing is that person to person, it can happen through what? Aerosol transmission also, guys. Okay. Aerosol transmission can also happen in the case of meningococci. In the case of meningococci, we say that there is a droplet spread. Okay. In the case of meningococci, what we say? That there is a droplet spread. Okay. So somebody sneezes up. So what is there? In that particular sneeze, droplets, they are produced up and they are being inhaled. They are being inhaled and there is a transmission through what? Through the nasopharynx and all. So it is being said that in our general population, 5 to 15% individuals, they are moving here and there. Healthy they are normal, and they are nasopharyngeal carriers. Okay, they are nasopharyngeal carriers. What is the meaning of that? Means to us, they will look like what? Normal persons, because they are harboring of what in their nares, in the nasopharynx of them, they are harboring of meningococci. Okay, वो हमें तो नॉर्मल दिखते हैं, लेकिन उनके नासोफैरिंक्स में क्या है? मेनिंगोकोकाई एज अ नॉर्मल कमेंसल. खुद वो क्या है? नॉर्मल. themselves what they are? they are healthy, they are normal. उनको कुछ नहीं होता. बट यही लोग होते हैं जो कि छींकने से या फिर किसी और पर्टिकुलर टच से, like they have touched somewhere, like suppose what we do whenever we sneeze and all, we try to do this and we open up a particular gate and all that, so organism is there. Okay, and somebody touches it and just touch like that, so that way also the infection can happen. Okay, but mostly it is through the droplet spread and the lungs are involved up, and after the lung it goes to the blood, and through this hematogenous route it reaches to the brain and lands of the person with what? Meningitis. So in most of the infections, the same thing happens, that there is a droplet spread or aerosol transmission involve the lungs, and through the blood it goes into brain and thereby involves of the meninges, and that is what is termed as meningitis. That is what is termed as meningitis. Is it fine? So this is the way by which the infection happens. The transmission happens by these particular ones, either iatrogenic, like through the some intervention that is being done by the doctor and all. Others like some local infections are there and that have gained access to the bloodstream, and from the bloodstream might go to the meninges. They have crossed up they are capable of crossing the blood-brain barrier, and that's why they have gone into the brain also. Okay, so that is one of the things. Besides that, in the meningo, there is a droplet spread after like sneezing and all. The lungs are involved, goes into the blood and involves the meninges. And that's why it leads to what? Meningitis. And I told her that 5 to 15% individuals, they are moving here and there and themselves they are healthy and they're holding of what in the nasopharynx? Meningococci. Okay. So this is regarding the transmission. What else? Suppose somebody is having what? CSF shunts. Okay. Suppose somebody is undergoing for hydrocephalus surgery and all. And what is having? The CSF shunts. So these particular CSF shunts which are there, they also harbor or they are also the storehouse of the infection sometimes. Through them also, the bacteria, they can enter off and they can involve the meninges. So that is also their presence of CSF shunts is a predisposing factor for this. Breach. There is a breach in the continuity of the layers of any sort, or just now told up that they breach of what? Blood-brain barrier. Okay, and that's why they could able to enter up and does the meningitis and all. So all these particular things you need to know regarding the transmission stuff of the various organisms which leads to this acute bacterial meningitis. Is it fine, guys? I suppose this much is clear. So if you can answer up these particular ones, Mansha, Tejashri, Hemant, Pallavi, up till now it's okay. You can put a thumbs up that yes, you are understanding. Is it fine? The transmission and the causative agents along with the definition and all. Hey guys, you can put up in the comment section. I'm seeing up. Okay. Now, coming to the various incubation periods and all. So for an acute bacterial meningitis, mostly it is 4 days to 10 days. That is what is the incubation period of acute bacterial meningitis. 4 days to 10 days. And what are the important features of meningitis, guys? The important features of meningitis is fever, vomiting, intense headache, and altered sensorium or altered consciousness. So this, I suppose you also know that there is a high grade fever. Okay, there is a high grade fever, and along with this high grade fever, there is a projectile vomiting. So there is a projectile vomiting, intense headache, and altered consciousness or altered sensorium. They are the important features of what? Important features of meningitis. Is it fine? Now, basically, in the meningitis, what happens, guys? Everybody knows meningeal irritation happens. What happens? Meningeal irritation happens, and this meningeal irritation we have in the form of nuchal rigidity and two important signs which definitely will be asked in your medicine exam also, and even we can also ask you in the second year that what are the meningeal irritation signs which you know. Okay, so one of them is nuchal rigidity, difficulty in flexion of the neck. Okay, Kernig sign and Brudzinski sign. These three immediately should come in your mind whenever somebody asks for the signs of meningeal irritation. Okay, so they can help you to pass also in the practical exam if somebody, your external examiner, ask regarding the signs of meningitis and you tell up these names, Kernig's and Brudzinski, then he or she will be knowing up that you have studied. Okay. So at least the names of them you should definitely be knowing. Okay. The names of them you should definitely be knowing. Now, as per the picture, I want to tell up that what is the Kernig signs and what is the Brudzinski sign. As you can see in this is upper one is Kernig sign and the lower one is Brudzinski sign. Okay. As you can see, as a doctor, you are there and you have made the patient supine like this, and you have put the hip flexed at 90 and you try to extend the knee. Okay, this particular knee you want to extend, but it is not able to be extended. Okay, because of meningitis. This is termed as Kernig sign. Is it fine? This is what is termed as Kernig sign. So patient is lying supine. This is supine, hip flexed at 90, and the knee which you want to fully extend, it will not be possible. And this is what is termed as Koenig sign positive. Is it fine? Then comes the Brudzinski sign. Brudzinski sign is neck sign. Okay, Brudzinski sign is a neck sign. And what is that? Because of the neck rigidity, because you know, nuchal rigidity is there, neck rigidity is there. So when you do the passive flexion of the neck, automatically themselves, the flexion of the legs and the thighs, they ought to happen. Okay. With the passive flexion of the neck, there is a flexion of the legs and the thighs. This is termed as which particular sign, guys? Brudzinski. Now, I am 100% sure that in your second year, you are confused that what is Koenig's and what is Brudzinski. Okay. So remember, like somewhat it can help you. Brudzinski sign, neck sign is which one? If you're confusing Koenig's and Brudzinski, B. This particular B. So in this, you are bending something. Okay. So you are putting up your hand under the neck and you try to bend. Okay. When you do that, the flexion of the legs and the thighs, they also ought to happen. So that is what is the Brudzinski sign. And Koenig sign is, I suppose now it's clear that patient is lying supine. Here also it is supine only. And hip is flex 90. And the knee cannot be fully extended as there is a problem in extending that. Is it fine, guys? So these two important signs should be remembered by you. And if you remember these particular signs in your exam, at least the examiner will got to know that you have studied well. Okay, that you have studied at least. They will be knowing that you have studied at least. Is it fine, guys? I suppose now this particular confusion of yours is over. That what is the Koenig sign and what is the Brudzinski sign? Okay. Is it fine or not? Is it clear? Tell in the chat box that Koenig's and Brudzinski is clear to you. Okay. Now, talking about the journal lab diagnosis in this particular one, that the specimen collection and the transport of it. So you know that obviously you tend to have the patient in the lateral position and you tend to do the lumbar puncture. And from that lumbar puncture, you try to have the CSF. Okay. Practically, how much CSF it comes? Hardly 5 to 10 ml. Okay. This much CSF it comes after doing the lumbar puncture. Okay. And this particular CSF, which you get after doing the lumbar puncture, you try to investigate this as soon as possible. Okay. Because it is advisable to go for the cultures and go for the other investigations as soon as you have the CSF from the lumbar puncture. Okay. Fine. And hardly this much amount comes out. Everybody says the 20 ml and all, hardly in the practically only 5 to 10 ml it comes up. And this particular one, like it's a practical question in the Viva question, they can ask you that suppose you could not able to process the CSF immediately. So will you refrigerate that? No. CSF should never be refrigerated. Okay. Then they will ask, why, sir? Why not? Because certain organisms, they are cold labile. They are killed by the cold conditions. So you should not refrigerate the CSF. Okay. If at all you are thinking that you can't process it immediately, you can keep it into what? Incubator. Incubator at which particular temperature? 37 degrees centigrade. You can keep it at what? 37 degree centigrade. Is it fine? Now, this is the overview. This is what is the overview of the meningitis which I have given you, and separately also all the organisms we will take. Now guys, this table right from the second year up to the final year and after that also in the NEET PG will not leave you. Okay, so you should have a fair idea regarding this particular table, and you should have an idea that what is the normal values and what happens in the pyogenic, what happens in the tuberculous meningitis, and what happens in the viral meningitis. You should have a fair idea regarding them. Okay, so we will take them one by one. As you can see regarding the CSF pressure, And see the units also. Don't confuse. The units are in millimeters of water. It is not centimeter of water, it is millimeters of water, and it is not millimeters of Hg. Okay. Mostly it is millimeters of Hg and millimeters of water we have taken up here. Normal one, the normal CSF pressure is how much, guys? 50 to 150. Remember like that, 50 to 150. Okay, in the case of pyogenic meningitis, which we are talking about, acute bacterial one, it is highly elevated. That is more than 180 it can go, and more than that also it can go in the pyogenic meningitis. I am again telling up the units are mm of water. And if it is in mm of Hg, then it comes out to be 7 to 15 mm of Hg. Okay, so that is a different altogether. So all the things, if you want to take up at one time, you will get confused. So don't confuse. It is in millimeters of water. Okay, it is in millimeters of water. So normal one is 50 to 150 mm of water, and pyogenic one is more than 180, more than 180 mm of water. Then if we talk about the tuberculous one, in the tuberculous meningitis, it is moderately elevated. Okay, it is moderately elevated. This we terms as highly elevated. In the viral meningitis, it can be normal or slightly elevated. Okay, in the case of viral meningitis, it can be normal or it can be slightly elevated. Is it fine? So this, first of all, you should able to infer up that the CSF pressure in the case of pyogenic meningitis is sufficiently raised. In tuberculous meningitis, it is moderately elevated. And in the viral meningitis, either it is normal or slightly elevated. Is it fine? Then you have the total leukocyte count, which you infer up in this particular one. The total leukocyte count in the normal ones, that in the normal CSF sample, it is hardly having 0 to 5. This much of the cells. Okay, and that to the lymphocytes. Whereas in the pyogenic meningitis, it is ranging up in this particular way. How much? 100 to 10,000. Okay, this much cells per mm of cube will be there. And see the difference. Difference is what is raised up? The neutrophils. What is raised up? The neutrophils are raised up in the pyogenic meningitis, as it is the name also, pyogenic. Tuberculous ones, see the number 10 to 500. And what is predominantly observed in the CSF? Lymphocytes. Fine. And in the case of viral one, 25 to 500, that is more like the tuberculous one. And see the predominant cells here also is what? Lymphocytes. Okay, here also is what? Lymphocytes. As far as the glucose is concerned, the glucose is 40 to 70. You just remember up 40. Okay, you remember a 40 mg. Okay, 40 mg per dl. You remember like this. Range it is 40 to 70. We remember 40. And in the pyogenic meningitis, it will decrease. It will decrease. It will become what? Less than 40. And it can decrease to which level? It can become 0 also. Okay. And why it can become 0? Because bacteria, they love sugar. Okay. Bacteria, they love sugar. शुगर के भुक्कड़ होते हैं, उन्हें शुगर बहुत पसंद है. तो obviously in the pyogenic meningitis, always it will be less, or it can go to 0 also. Remember that. It can go to 0 also. As far as the tuberculous meningitis is concerned, this should be the range 20 to 40 mg per dl. Means there is a decrease, but it is slightly decreased. It is slightly decreased. Whereas in the viral, and even I can add upon here fungal also. Okay, fungal and viral meningitis, this particular thing remains normal. This particular thing remains what, guys? Normal. In the case of whom? In the case of viral or fungal meningitis. Viral or fungal meningitis. Is it fine? Means virus and fungus. इन दोनों को क्या है? कौन सी disease है? Diabetes. Remember like that? They have diabetes. They do not love sugar. And that's why their CSF sugar is normal. Whereas जो सबसे भुक्कड़ लोग हैं वो कौन है? Pyogenic meningitis वाले. Bacterias. They are there which love sugar. And they tend to reduce it to 0 also sometimes. TB is also a bacteria, and TB is also a bacteria. Okay, remember that. But there is a only slight decrease. Means it is sophisticated type of a bacteria. It loves sugar, but less. Okay. In the tea, it will be needing what? Less of sugar. I suppose now it's clear. Okay. And this is the important criteria which helps to distinguish between these three important ones: pyogenic, tuberculous, and viral or fungal meningitis. As far as the proteins are concerned, again, a range is there 15 to 45. You take it as 45. Okay. The upper range 45. Total proteins, milligram percent, can be this much in the normal ones, and they tend to increase more than 45 in the case of pyogenic, and can reach up of what, more than 250 also. That is markedly increased in the case of pyogenic meningitis. Whereas in the case of tuberculous ones, again, it is moderate to markedly increased. Means both the bacterial one, the proteins, they tend to increase markedly or moderately. Moderate to markedly increase in both of them. Fine. As far as the fungal one is concerned, either it is normal or slightly elevated. Either it is normal, the proteins are normal or slightly elevated. Okay. So this particular table of your book is not easy to handle. Okay. Lot of students, they are confused in this table only. So the easy way which I tell you now, that will help you throughout, and if you go by that, this funda of having the numbers and all will go away. Okay. So remember like this, that in the case of pyogenic meningitis, if you don't want to remember this table, you can remember the things this way also. That in the case of pyogenic meningitis, okay, what happens to the count of the leukocytes? So obviously you will get the neutrophils, and they are markedly increased. Neutrophils, they are markedly increased. So that is one of the things. First of all, they are markedly increased. Is it fine? Then now you should also try. Whosoever is there in the chat box and all, they should also try here that in the pyogenic meningitis, the neutrophils are markedly increased. Now, if I ask you guys, what about the CSF glucose? Do the bacteria loves glucose? They love it very much. They love it. Okay. So obviously it will decrease, and it can decrease even to zero. Okay. It can decrease even to zero also. The CSF glucose decrease up in the case of pyogenic meningitis. Whereas in the case of proteins, what about the CSF protein levels? The CSF protein levels, they are moderate, or you can say markedly increased. Okay. Moderate to markedly increased is there in the pyogenic meningitis. And if you write up like this also in your exam now, nobody can cut your marks. Okay. If you don't tell the numbers and all, and you just write up like this is also 100% correct. Okay. Full marks that fellow have to give you if you give the CSF profile in this particular way. Is it fine, guys? Now, if somebody talks about the TBM, TB meningitis, that is a chronic meningitis, TB meningitis. In this, there is an increase, but the increase is of lymphocytes. The increase is of what, guys? Lymphocytes. And what happens to the CSF glucose? It is a sophisticated type of a bacteria. It loves it, but not much. So that will be decreased, never zero. And what happened to the CSF proteins? They are the bacteria, they tend to increase the proteins. So here also it can moderately, or sometimes it can markedly increase, as it is there in the pyogenic ones also. Okay. And some of the reference books, they say that in the pyogenic meningitis, they are moderately one increased. And in the case of TB, they can be moderate to markedly increased. So number of books, they say number of things, but one thing is for sure, that the proteins, they increase. Okay. One thing is for sure, that the proteins, they increase. Okay. So this is what is the story of TBM, TB meningitis. Lymphocytes are increased, CSF glucose is decreased, and CSF proteins, they are either moderately or markedly increased. Is it fine, guys? So remember this particular aspect also. Then, can you tell me about this particular CSF profile? Can you tell me about this particular CSF profile? So this particular CSF profile, what you are seeing up, lymphocytes are just increased, or it can be normal also. Okay. And what about the CSF sugars and all? Guys, this is normal. CSF proteins, normal or slight increase. So please tell in the comment section that regarding which particular ones we are talking about. Regarding which particular ones we are talking about by this CSF profile which you are seeing here. The lymphocytes are slightly increased or normal. The CSF sugar is normal. The CSF proteins is normal or increased. What we are talking about. So guys, I suppose up till now this should be clear to you that we are talking about what? We are talking about either the viral or either the fungal meningitis. Okay, either the viral or either the fungal meningitis in which this sort of a scenario tends to come. I suppose now this particular table of yours, which is a real pain, okay, now will become more easy for you. If you write up this also na in your exam, guys, pyogenic meningitis this, TB meningitis this, and this for the viral and fungal meningitis, nobody can cut your marks. Okay, nobody can cut your marks in the lab diagnosis and all. So guys, what we have seen that we have taken up the CSF from the lumbar puncture and hardly how much it comes 5 to 10 ml. Okay, that particular thing one comes, and this 5 to 10 ml of CSF is distributed into 3 labs. Which 3 labs, guys? To the patho department, to the micro department, and to the biochemistry department. Okay, hardly it is how much? 10 ml, and it is being divided into how many? 3 parts. Okay, goes to the path, goes to the micro, and goes to the biochemistry lab also. Now, what these particular fellows they do with it? The pathology ones, they are the ones which tells you the cytology, which we have just discussed up. Okay, just discussed now the neutrophils, lymphocytes. Who will tell? The patho department. What is our concern? The microfellows. Our concern is that to give the correct diagnosis, immediately we should put it on culture. Okay, we should culture the important things firstly, and then we should go for the gram stain also. Now you can say that where will culture, sir? Culture can be done on the normal medias like blood agar. Okay, and some special medias are also there which will be known as per the gram stain profile. Okay, then you can use those selective medias. Fine. But as such, mostly the culture is being done on blood agar and Mekong agar also you can put up. Talking about the biochemistry, B is biochemistry. They are the persons which tells you regarding the CSF proteins, and they will tell you about the CSF sugar. Okay. So these 2 parameters like of proteins and sugars, they will be told by whom, guys? They will be told by the biochemistry fellows. Okay. They will be told by whom? They will be told by the biochemistry fellows. I suppose this much is clear. Okay. I suppose this much is clear that whenever this particular amount of CSF, which is hardly 5 to 10 ml, which comes up, it is divided into 3 parts. That is patho department, micro department, biochemistry department. Patho fellows, what they tell you, वो बताते हैं cytology कि कौन से cells बढ़े, lymphocytes बढ़े या neutrophils बढ़े. Then you have this microbiology fellows. What they are there? Culture. They will put it for the culture on the blood agar, and obviously of that particular CSF, what they try to do? The gram stain. Because from the gram stain, they can have the hint that which way they have to go. Biochemistry fellows, what they do? They go for the sugar and the proteins. Okay, they will tell you the sugar is 0 or is it less, markedly less. What about the proteins? Increased, moderately, markedly increased, or it is normal. So this particular thing is being done by the 3 labs. Is it fine or not? Okay. Is it fine or not? Now you are finding this particular thing easy or not. So you have done the CSF to these particular labs you have sent up, and you have done the cytology, you have done the culture, you have done the biochemistry profile. Okay, and I have told you to write up this instead of that particular table. You will be more accurate because in the exam, it is better to be clever than to be correct. Don't get into the trap of 40, 45, that sugars are like around the 40 mg per dl and the proteins are 45. Don't get into that trap. Just remember, glucose is decreased where it is increased, where the proteins are increased, where the profile mostly remains the normal. Is it fine? Now, guys, when you have done the gram stain, okay, you must be knowing that how we do the gram stain. And suppose you do the gram stain. These are the various possible scenarios which you can get in the CSF gram stain. These are the possible scenarios which you can get in the CSF gram stain. And I told you, na, in the question, they can change anything, one and all that. They can do this. They can just change up the gram stain picture and you have the other organism with you. Okay. So this particular table is very, very important to remember that what we are talking about. So guys, what we are talking about is this, that if somebody says that in the CSF finding, suppose the case scenario is there and the CSF finding, they say there is a gram positive cocci in pairs. Okay. Pairs means diplococci. Capsulated. It is capsulated. It is flame shape. It is lanceolate shape. It is gram positive. And it is a diplococci. Just now I told pairs means diplococci. Okay. And it is flame shape or lanceolate shape with clear halo. Halo means the covering around. So that means capsule is there. If this is the scenario in the CSF gram stain given in the exam or in the paper, what is the answer, guys? It is suggestive of which particular organism? It is suggestive of pneumococcus. This particular one is suggestive of what, guys? Pneumococcus, whose another name is what? Streptococcus pneumoniae. Is it fine? So these are the important things, important, what do you say, hints, which they will give in the case scenario regarding the pneumococcus. Is it fine? So that should be known. Then, guys, if they say this way, this is the first possible gram stain which can come. The second possible gram stain picture which can come is this, a gram negative diplococci. Okay, gram negative diplococci. Diplococci means again, guys, what? Pairs. And they are capsulated with adjacent sides flattened. Means they are lens shape or half moon shape. Okay, lens shape or half moon shape. If this type of a picture is being given up, or they say in this question these statements, negative diplococci, lens shape, capsulated, and I add from my side, they can say that in the patient rash is also present. Okay, in the question I'm saying, not obviously in the CSR gram stain you will not see the rash, but if in the question that hint is also there or rash present, then there is no confusion that we are talking about which particular bacteria, guys? Meningococcus. Okay, which is a gram negative diplococci, which is lens shape. Okay, now next one. Whenever you observe pleomorphic word, whenever this particular pleomorphism means which changes shape. So pleomorphism, whenever you see and gram negative cocobacilli, that is being observed along with the capsule, it is being there, and this particular word comes coco. This particular word comes pleomorphic. We are talking about Haemophilus influenzae, guys. We are talking about what? We are talking about Haemophilus influenzae. Okay, Haemophilus influenzae, it's an important causative agent of meningitis, definitely can be asked in this particular fashion. And what they can ask, other than that, guys, here, they will give a hint that this particular organism is being cultured on a specific culture media, that is chocolate agar. Okay, this is gram stain picture. But what the extra hint you will get in the exam, that it is being cultured where? On the chocolate agar. So if it is cultured on the chocolate agar and this particular picture is being given on the gram stain, that it is pleomorphic, gram negative, cocobacilli, capsulated, we are talking about which particular organism, guys? Haemophilus influenzae. Remember that. Now, other than that, what else? Gram negative bacilli. Gram negative bacilli arranged singly. If this is just written up and they do not write anything else, so you are confused that what it can be. But if they add upon to this, that the same organism is found to be lactose fermenter also. Okay. And this particular one is associated with causing up neonatal meningitis and all. Or these are there in the question, then you can infer from this knowledge that we are talking about E. coli. Escherichia coli is a gram-negative bacilli arranged singly and is a lactose fermenter. And lactose fermentation, this property is seen on which particular media, guys? Mekong agar. Okay. The fifth possibility is what? The gram-positive cocci in short chains. The gram-positive cocci in short chains. And the cocci is there and short chains is there. Okay. Short chains and cocci. Fine. They are talking about what, guys? They are talking about the GBS. And what is GBS? Streptococcus agalexia. They are talking about what? They are talking about Streptococcus agalexia. Gram-positive cocci in short chains is a typical example of what? Typical example is what? GBS. Group B strepto, also termed as Streptococcus agalexia. Now the sixth and the important one is a gram-positive short bacilli. If they write up this, a gram-positive short bacilli in the CSF gram stain, and along with that, they add upon from their side only in the property what? Tumbling motility and all that. Okay. In the property, what they add upon, guys? Tumbling motility is there of this particular organism, and it shows tumbling motility at which temperature? 25 degrees centigrade. Okay. And it is non-motile at 37, that is the body temperature. This particular property is termed as differential motility based on temperature, and it is a short bacilli, and it is a gram positive. So guys, we are talking about what? We are talking about Listeria, and this is termed as Listeria monocytogenes. Okay, this is termed as what? Listeria monocytogenes. Okay, so guys, every other study is different, and this particular chart is different from this. Definitely, you will get in your NEET PG also, in your prof exam also, one question. So this is a very, very important table types, okay, which should be in your mind regarding the microbiological point of view. And if this comes up and you answer, then you will get the full marks if you write up this also, that there's a gram-negative cocoa bacilli, okay, grows on chocolate agar. So at least the examiner will be knowing up that you have tried. You are not remembering everything, but you tried. If you write out tumbling motility and all, that definitely will be having in the idea that you have tried. Is it fine? This particular table and this particular table, if you able to get this particular one, otherwise this, that is the pyogenic meningitis, TB meningitis, or this one, that is the lymphocytes increase or normal, that is regarding the viral and fungal meningitis. If you write up these two things also, whenever the question of meningitis comes, along with those two signs, Brudzinski and Kernig sign, your work is done. Okay, your work is done. Definitely you will have out of 10 easily your 7 to 8 marks. Easily you will have the 7 to 8 marks with this much of knowledge only. If you get this much of knowledge also regarding this table and this table, your work is done. Okay. And I've told you overall the most common causative agent is pneumococcus. Other age groups, I've told you, except the neonates, everywhere it is pneumo. So other age group means neonates. So neonatal meningitis, it is GBS. Group B strepto or streptococcus agalexia. Okay, guys. So my basic, because the prof exam is very nearby of yours, I don't tend to waste up your time in telling up all the details and all that. I'm telling you the crux. If the meningitis question comes, define it. What is meningitis? What is the difference between meningitis and encephalitis? I told you meningitis is what? That is the inflammation of all the meninges. That is pia mater, arachnoid, and dura mater. Mostly in the subarachnoid space, there is inflammation, and neutrophils they increase up in this acute bacterial meningitis. Fine. Then we have discussed up if the brain parenchyma is also involved up, that is termed as encephalitis. If both are there, meningo and this, to meningoencephalitis. Is it fine? We have to like shown you the table also, that particular diagram also. Then we have talked about that what are the causative agents as per the age, that also is done. Then how does the infection happen, sir? That is a direct spread, or it is through the aerosol route and all that, or iatrogenic ways also are responsible. And mostly it is secondary, that through the blood it goes and then it breaches the blood-brain barrier and reaches up into the brain. And thereby it does this meningitis and all. Then we talked about this, that collection and all that we collected by the lumbar puncture. Hardly 5 to 10 ml comes, and this 5 to 10 ml is to be divided into three parts. That is, I told you, the pathology, microbiology, and the biochemistry ones. And thereby you do these particular things, cytology, culture, and you go for the biochemistry stuff, CSF sugar and CSF proteins. Is it fine? And this, I told you the profiles, that what is increased in what. In the pyogenic one, neutrophils are increased, glucose is markedly decreased, CS proteins are increased. Okay. As far as the TB meningitis is concerned, lymphocytes are increased, CSF glucose is decreased, proteins are also increased. Whereas in the viral and fungal, the lymphocytes are either slight bit increased or normal, CSF sugar is normal, and CSF proteins are also normal. Okay. After that, we have discussed of the CSF gram staining pictures of these particular ones, the properties of them. If you remember this much also, that somewhere the lanceolate is coming, somewhere the flame shaped stuff, flame and lanceolate are the same. Okay. Diplococci, and that to gram positive, pneumococcus. Gram negative, capsulated, lens shape, meningo. What is the other important thing? Rash. Okay. Pleomorphic, gram negative, coccobacilli. What is the other thing? Grows on chocolate agar. And if you remember, if you have studied up, it shows a property also, guys, that is termed as satellitism. We are talking about Haemophilus influenzae. Fine. Gram negative bacilli arranged singly and grows on McConkey agar and produce what? Lactose fermenting colonies, E. coli. Gram positive cocci in short chains, GBS, Streptococcus agalexia, and what they can give in the stuff, that the CAM test, the Christie-Atkins-Mudge-Peterson test, that found to be positive in this particular case of GBS. So that is Streptococcus agalexia. Gram positive short bacilli. If this is the one, and along with that, they say that it is having tumbling motility, and they can give that they are motile at 25, non-motile at 37. This is termed a differential motility. That is being shown by Listeria monocytogens. Okay, this is being shown by Listeria monocytogens. Is it fine? And as far as the treatment part is concerned of these particular ones, for most of them, you use a third generation cephalosporins. Okay. But it is being said that as per the Harrison, that for the meningococci, okay, as per the pneumococci, these particular ones, you firstly have to use penicillin. As per the Harrison, they say the drug of choice for them still is penicillin. Practically nobody use, but still they say the drug of choice for them is penicillin. And obviously, the third generation cephalosporins like ceftriaxone, they can be used. In fact, they are the more effective drugs. But if somebody asks, what is the drug of choice? Drug of choice is penicillin. As far as the listeria is concerned, guys, remember one thing. For the listeria, the drug of choice is ampicillin. Okay, and how to remember that? Remember like this. L-AMP, LAMP. Okay, listeria drug of choice is ampicillin. For the meningo and pneumo, drug of choice is penicillin. And third generation cephalosporins is found to be most effective. Practically, we use this only, ceftriaxone and all. But as per the bookish knowledge, the drug of choice is penicillin. Okay, so guys, this is the overview of the things. I know that it is like a full-fledged more also, but if you have a crux idea of this much also, then most of your problems will be solved in the prof exam. And even I'm saying for the NEET exam also, NEET PG. Okay. So is it, so you have understood or not? Is it fine? You can tell up in the comment section and all that is this particular topic have become somewhat simple for you or not? And if you have any queries and all, definitely you can ask me on the DocTutorial channel. Along with that, you can ask me on my Instagram channel, which is by my name only. Along with that, you can ask in a Telegram and all that. Okay. So very best of luck, and we'll be joining up for the next session after a few days. And this much knowledge, if you also have this question of meningitis, which is a short to come in the prof exam, will be a deal to be done. Okay. So thank you so much. Keep studying well. You're studying. Important is in the prof exam that 80-20 principle that you term the Pareto principle. What is the Pareto principle? The principle is that 80% of the things they like everything you have no need to study everything. 20% of the things they come 80% of the times. And if you like see your university papers also, whatever university you are in, you will observe that this 20% topics have come every time in some form or other. So that is what is the story. Okay. So you will see that meningitis is there in short note also, sometimes in long question also, sometimes in the MCQ stuff also, but it will be there because it is that 20% which will be asked 80% of the times. This is what is termed as Pareto principle. It will remain so. So if you are an intelligent fellow, a smart fellow, what you will do? You will just gather up your university exam papers of 5 years, which you can get on our DocTutorials app also. Okay, guys. So that also I want to tell up that we have a MBBS competency based app in which all the subjects of the second year are being covered up, that pathology, microbiology and pharma with the DocTutorials. And if you see that most of your confusions of the exam, which are like because of the competency and all, will be over. So in my view, you should go for that, and you can have the links also in the comment section of that particular one. You can just download it. You can see the demo videos, and definitely you can purchase it off. It will be, or like exam is very near, so obviously you can tell up to your juniors that particular one, that you can have that particular app, and it will make their life somewhat bit easy. Okay. So I suppose this 1 hour have made your life somewhat easy. Thank you so much. Take care. Bye bye.